My name is Ignacio García Bolao, and I work in Pamplona in the University Clinic of Navarra from the University of Navarra, Spain. Well, the localized contact force was a multicentric European study showing basically that adding local impedance as a biological marker of durable lesion was superior to the classical way of performing ablation, which is exclusively based on interlesion distance and contact force. The history of the LOCALIZE CF trial begins some 3-4 years ago with the LOCALIZE trial. The LOCALIZE trial was also a multicentric, non-randomized trial showing that local impedance alone with the MiFi catheter was an independent predictor of durability. The LOCALIZE trial showed the importance of local impedance in achieving durable transmural lesions after a 3-month follow-up. This trial was recently published in Europace, both the acute data and the chronic 3-month remap of those patients, and settled the concept, the importance of the local impedance drop in AF ablation. Here in the LOCALIZE CF, we tried basically the same in the sense of adding local impedance to a current generation of contact force catheter. So our rationale was that contact force was not the only important thing for assessing transmurality, but also the concept that adding local impedance, the values of local impedance as a, let's say, a biological marker of lesion, the reaction of the tissue, not only just the force, was also an important parameter to improve results for PBI. The main finding of the LOCALIZE CF trial is that when you add local impedance drop over 20 ohms to a typical contact force and interlesion distance figures, it improves the result of PBI in terms of durability and transmurality of the lesion 3 months after the ablation. For me, the main clinical implication of the LOCALIZE trial is that adding local impedance to the classical concept of contact force will improve the result of PBI, especially when we have a strong, very strong proof on the 3-month remap of those patients. The main conclusion of the LOCALIZE trial is that when you get an interlesion distance below 5 millimeters, contact force over 9.5 grams, and you add local impedance drop over 20 ohms, the durability of lesion is by far superior than when you get just interlesion distance and contact force parameters. The home take messages for the LOCALIZE CF trial is that, first of all, local impedance gives you a complementary information to contact force. Contact force is a very useful parameter of physical contact between the catheter and the tissue. Local impedance, on the other hand, gives you the clue of a biological reaction of the tissue to the radiofrequency energy. So both are complementary, and possibly both are important for PBI.